Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Breast conservative surgery and its contraindications. So let's look at the absolute contraindications. So absolute contraindications, it includes the first trimester of the pregnancy, and next is the diffuse microcalcification. So it's diffuse microcalcification, and there is persistently positive pathological margin. Positive pathological margin. Then comes the multicentric tumor. So in terms of the multicentric tumor. Next we look at the relative contraindications. So under this, it includes the CTD, that is the connective tissue disorders. And what does it include? It includes the SLE, that is the systemic lupus erythematosus. Next, there is also the scleroderma, and there is also the RA, that is the rheumatoid arthritis. Next, we move on to the large lump to breast ratio. So the large lump to the breast, large lump to the breast ratio. So this is a big lump in the small breast. This is presence of the big lump, and this will be in a small breast. This is in terms of a small breast. Next is the lump beneath the nipple areola complex. There's a lump, and this will be beneath the nipple areola complex. Nipple areola complex, and also the multifocal tumor. So there is multifocal tumor, and there is a history of the therapeutic radiation exposure to the chest wall. So history of the therapeutic radiation to that of the chest wall. To learn and grow daily like this, please do subscribe.